Every year, approximately 130,000 applications are submitted to the Medical Services Plan. British Columbians know MSP as their public health insurance. But for new residents, late teens, and seniors, figuring out how to enroll or even find information about MSP was a real challenge. The Ministry of Health and GCPE's Strategic Design and Transformation branch combined forces to make things easier for citizens.
The goal of the project was to create an exceptional digital service experience for citizens and reduce time and frustration for staff and citizens.
Thankfully, the BC Service Design Playbook paved the way for the team's approach from beginning to end. The research was a combination of pulling quantitative data and getting out and talking to real people about their experiences, a central principle of service design.
Absolutely, it's important to talk to citizens about what they need and what their challenges are. You know, government in the past has been making decisions about government services in boardrooms, and you know, people in government often have a very good understanding of who their users are. But getting out into the field, talking to real people, watching them accessing services, talking to them about their past experiences really brings the reality of what people are actually experiencing and what things aren't working well for them and what things we can fix for them. So yeah, it's absolutely important to talk to citizens and get out there in the field.
Several communities, and 62 citizens later, the research showed that it wasn't just the online experience that needed to be improved. There was a much bigger story. These kinds of challenges usually take a couple of attempts to solve. Knowing that, the team took an iterative and human-centered approach. The MSP project was more than an online form design. It quickly grew into something much more complex.
The MSP project is actually really important for the BC Public Service because of how the idea came in from citizens through the red tape engagement. So it was like data and citizen feedback that drove us, the service design team, to actually work on the MSP project. It was a project that was cross-ministry. We worked with a lot of different stakeholders, and the actual output. So we actually implemented something, which is also new for our practice. So going from end to end with a client and creating a digital experience. So just the whole journey of the project, coming in from citizens, from our citizen engagement team, really listening to people saying, hey, this is what you asked for, and we created something. So I think it's a powerful narrative that is a really new trend in government.
The team didn't quite know what they were in for when they took on the project, but what they ended up with was a model for other types of change in the BC Public Service, and for citizens, an easier and more effective way to access the health care that they need.